I thought once I had hit all those points that I wouldn't even really be like a trans woman anymore. I was just going to be a woman. Every complication that could have happened after I woke up completely happened. I was closing inside. I was like almost reopening myself up, which is pretty much what you have to do. But mine felt like I was ripping myself open.
I am wholeheartedly against children going through a medical gender transition. It's quite a controversial topic, and most people who are involved in this debate have no idea what it's like to transition as a minor. And that's why I'm so honored to introduce you to today's guest, Briana Ivy. Briana is a 22-year-old trans woman and transitioned as a minor, and she's going to talk about all the complications and all the serious side effects that she experienced during her transition, and about the importance of leaving gender dysphoric children alone. So the first thing I want to ask you is, when did you start your social transition?
I knew since I was like 6, 7, like ever since I started school in like first grade, I just never felt welcomed by the boys around me. I didn't feel approved by them. I didn't feel in community with them at all. I just felt a lot of difference. I noticed though that I didn't feel that way around girls and women. I felt so much similarity, so much connection in ways that like I couldn't really explain because I mean I was only 7. But people thought I was gay since around that age. Like I remember being called that all the time. And so I kind of just assumed that to be my identity and kind of just went from there. But when I was around 12 is when I started to see trans people online, and I saw like Jazz Jennings and all that kind of stuff, all the interviews that she was doing around the time. And that was when I felt like I knew that I was trans, was because I saw myself in their shoes. I saw myself in that same experience and feeling that they were all describing. And so I started socially transitioning when I was 13. That was when I had a different name. I started to dress differently. I started to grow out my hair. I started to experiment with makeup and just presenting myself as like a female person at school and to everyone around me. It seemed like as soon as I had decided that, everything kind of went really fast. Like I started socially transitioning, like I wanted to just do it as quickly as possible. I was so scared of looking in between or not, or people just not thinking I was female, especially because people knew me as a boy since like forever. I just had so much anxiety around people not seeing me in the way that I wanted them to see me. I just tried everything I could to transition like in my appearance as much as I was able to control as a 13-year-old.
When did you start your medical transition, and what was the first thing that you did medically?
That was right at 14. There was a gender clinic that my parents and I found downtown in Indianapolis as part of Eskenazi Hospital. I had written to them like what I had seen other trans people do online, talking about getting hormones and like transitioning your body like medically and all of the amazing changes that you experience doing that. I wanted it more than anything and I felt like it was the right thing to do. And at the same time, I didn't really know anything about it though either. It's kind of hard to describe, but as a kid, like the only information I saw online was like people just talking about the body, like the amazing changes that you go through and all the ways that your appearance will change. And it just seemed so magical, like especially to me as a 13, 14-year-old. And so my parents and I, we just didn't know anything about trans people. We didn't know any transgender people around us. We didn't really know how the hormones worked, what you had to do. That was why we found this gender clinic that was downtown and they kind of did everything. And you just had to go in and they would kind of guide you through the whole process. And that was what we did. I was 14 and I had my first appointment there. And then the first thing I did was immediately the Lupron injection, like the blocker, and then the hormones.
It's interesting you say that they made you feel so comfortable and safe. They were basically like, we've got this. Don't you worry. We're going to take care of you and we're going to do everything for you from now on.
It made us feel like this is the right thing to do. Like these people are experts. They know what they're talking about. And they're like, yeah, this is exactly who I am. And this is what we need to do. And this is the right way to do it to make your child the happiest, to make me feel happy, and to make me feel like I was going to be the person that I always thought I was going to be. And so it just felt like such a miracle. It really did. It felt like such a cure to every sort of negative feeling I was having, which was a lot. at the time, especially like at my age. Like I was just going to transform so much, is what it felt like, that I was just going to go through such a powerful like transition being so young. And I was going to see so many changes that a lot of people wouldn't if they had started older. It just seemed like everything we were asking for.
How was the process of getting the puberty blockers and cross-sex hormones, and how long did it take?
It really wasn't that long. It was a 30-minute sit down with a clinical social worker. And it started off with and anytime I was in there for an appointment, they go through like a series of just yes or no questions, asking you, do you feel discomfort with your gender? Really baseline yes or no questions, quick to answer. That was how it started. And then we had like a couple of conversations about it. I remember some things about what is it I didn't like about my body, or how is it that I envision myself mentally? How did I want other people to see me? Like those kind of questions. But it was a 30-minute appointment. And at that point, at the end of it, I had the prescription. And then in the next appointment, which was just like really short after that, was when I had the first injection.
Did anyone ever talk to you about the side effects at the clinic?
Yeah, no, that's something that I feel like is such a really big regret and disappointment of mine, like looking back. I was doing things and I didn't fully understand them. And it's not so much that like I regret the choices, because I don't know what my life would have been if I hadn't done it. So it's hard for me to say yes or no to like whether or not I would do it again. But I am just really disappointed in the fact that really the information that we had about the blockers and the hormones, we focused on the changes that would happen with hormones. And some of the side effects they talked about were things like mood swings or possible weight gain. And I remember I had no idea that like I would never have a sex drive at all. I was only told that it was just like decreased libido was how it was put. So kind of talking about it like it was birth control, kind of like the way that they would describe those side effects of like some of those pills. It
Right.
sounded very similar. And I honestly thought that they were pretty similar just based on that.
Mhm.
That was really the only conversation, was really talking about the effects of the estrogen and some of the side effects. The side effects, just the way that they were put, seemed so minor, seemed like almost like birth control side effects. Not saying that those are any better, but for something that is so widely consumed, it just seemed like alongside a drug like that. I didn't really get any papers about it or anything. I never took home really anything about here are things that'll happen. Here are a lot of side effects. It was really only a discussion about the estrogen. There was no conversation about the testosterone blocker pill that I was taking. There was no discussion either about the puberty blocker. The way that it was told to me and my family was just that you just have to take them alongside the hormone. Because I was already 14 and I hadn't gone through a lot of puberty really at all, like it was just starting, I only had the injection twice. And then I slowly went to hormone replacement.
Yeah, so when talking about side effects, they actually cherry pick. They deliberately choose to talk about certain side effects where you would be like, I don't care, just give me the medicine.
Yeah, it seems so typical, if that makes sense for a medication. It didn't seem like anything abnormal that even would be long term. It just sounded so minor. They just really emphasized the bodily changes and like all the changes I would go through that would make me feel affirmed is the right, yeah, the right word. That was the primary focus of the conversation.
When did you get your first gender related surgery, and how long have you been on hormones?
Yeah, so my first surgery was I had breast implants and my nose done at the same time. I was like just turned 18. It wasn't long after I turned 18. I knew that that was what I wanted to do first, especially as a teenager. So I had been on hormones and blockers for about 4 years at that point. Even though I had a lot of change on the blockers and the hormones, I just never felt like it was enough. I just looked at so many other trans women online, and so many other people that seemed happier had gone and also had surgeries as well. And that's a very common thing in the trans community. People get surgery all the time. And so I felt like that was a necessary thing for me that I needed to do. It was such a weird feeling. It just never felt like enough. Like I didn't feel like I was ever changing enough. I didn't feel like people were seeing me as female as I wanted them to. Also, in the gender clinic, they had talked about like different surgeries that are really common for trans women to get, and that if you're younger, you heal better and you have better results. there was just such a large conversation about like sort of the beauty in transitioning really young because you heal better, you have better results, you look better, you feel happier. And so it just kind of put me on that track of now that I've done the hormones for a while, I'm ready to do surgeries. And so that was the first one. But I was also kind of planning a lot of things all at once, just because I knew that, especially for something like a bottom surgery, just it's not like it was so easy at the time for me to just kind of find a surgeon, especially in the area I was living. And so I started to plan that right around when I was 18 and kind of started to see like what were the options, especially because I had seen it online and I had heard the gender clinic, like that my primary care doctor that was there. I heard her talk about it and telling me that they could refer me to people if I had decided that I wanted to do it. I was planning that around the same time. I had the consult for it, the first one with Dr. Gallagher, before I even had the implants put in. Maybe like
Okay.
2 months after I had my consult with her, she relocated to Florida.
And then you ended up with the doctor who studied under her, right?
Yeah, he studied alongside her. I believe she kind of taught him, I guess, like mentored. I'm not sure if it was like a resident situation. She was the one that referred me to him, Dr. Roth.
Even though it makes sense, I think it's a little bit weird how normalized surgeries are within the trans community. And I'm not talking about getting one or two surgeries, like minor procedures. I think it's literally socially acceptable to be addicted to plastic surgery within the trans community, and I don't think that's really healthy.
Yeah, absolutely. And I saw that since I was little, like 13, 14. I picked up on that. I saw that online. The trans people, like especially trans women, I mean, it's everybody in the trans community. Surgery is a big part of medically transitioning. But for trans women, and I think that that's because even biological women and having plastic surgery, it's a similar experience, although for trans people it's obviously different kind of bodies. But I remember being 14, 15, and starting transition, and I would just look at trans women online, and the ones that were the prettiest, the happiest, the most popular had all had so many surgeries. They looked so good. People loved them. People treated them like the way that I wanted to be treated, and I just idolized it. And it made me feel like that was why I wasn't happy, was because I just wasn't at that point yet. And that it takes getting to that point to be happy and to be seen the right way in the world. People become addicted to cosmetic procedure all the time. And even I questioned if that was happening to me, if I was putting all of my faith and that I would be happy with just by getting surgeries, and that was the reason I wasn't. I became worried that over time, is that what I'm experiencing right now? Is it an addiction? And especially when it's related to a transition, I think because a lot of trans people, there's other mental things going on. Compiling like the need for a lot of surgeries really doesn't fix that. Maybe for some people it does, but unfortunately I think for our community and for trans people it's advertised that way. That is the reason why, is that they're just not being given the care that they need to look the right way. And so that's what's causing a lot of negative feelings and a lot of negative mental health problems. And so I feel like plastic surgery is just on such a high pedestal for trans people, and it's so promoted and endorsed.
So, when did you get bottom surgery, and what type of bottom surgery was it? Because yours was different, right?
Yeah. I had the first consult, I was 19, and it was right when I turned 20 that I had the bottom surgery with Dr. Roth. And it was very unique in that it was the peritoneal pull through vaginoplasty. So the long practiced form of that surgery is the penile inversion. I know it's a little more complicated than this, but a simple way to put it is that they kind of invert the penis to create the inside. And that's been the one that's done the most and just has had the most results over time. And then there's also one where they can use a graft of the colon to do it. But a lot of people don't like it because there's a lot of health risks associated with it. There's a smell. You can be on a colostomy bag. I remember being told that. It's also prone to infection as well. And so when I met Dr. Roth was when I found out about the peritoneal technique. So he said that what they can do instead is they can go in like laparoscopically with like a robotic arm, and they can take like a graft of like the lining of the abdomen, like the skin, and they can use that to create the inside of the new vagina. And I was so fascinated by it because I never heard of it. It sounded, and He told me that it had the most natural result. It looks the best. It feels the best. It just seemed so brand new and so exciting. And he had also told me that I would heal so well because I was so young and I didn't have any really health problems at the time. And so it just sounded like exactly what I needed, especially because the penile inversion wasn't going to be ideal because I didn't have a lot of development in that area because I was on blockers and on hormones. Going through like your whole puberty on that, you don't really go through much of a puberty. It kind of just it's hard to explain. Because I think another misconception I had was that taking hormones and the blockers that I would just go through a female puberty. But in reality, it wasn't fully like that. It really wasn't, just because it's not really a substitute. Like it's not like this induces like a biological female puberty because obviously your body is not like that at all. You're not having fluctuating hormone levels and changes with the rest of the body that comes with the natural puberty. You're just on a steady amount. You have changes to your body, but certain things just don't happen, and it happens in a very different way. And one of them is that you just don't develop really sexually at all. I had some growth, but it really wasn't significant. He told me that I could do a penile inversion procedure, but it just wasn't recommended. He said you would lose so much depth internally, especially because there's not a lot of tissue to work with, and there would be a lot of complications trying to do it, and you would absolutely need revisions done. It just seemed like everything was stacked against me, and that this was really the only option I had, and I didn't want a colon graft either.
No, of course. If they asked you, would you rather do the colon graft or the abdominal graft? You would choose the abdominal. How did it go with your surgery?
It was really bad. In telling this story, I've had a lot of people tell me that when you have these things done, you're given so many different documents and papers about all the complications, all the risks, and all the things that go on. And I have went back and I looked at every paper I had, and what I had was a pre-op document that was 4 pages, and it talked about kind of the preparation you needed to do before the surgery. And it also talked about some of the risks and some of the things that happen after. But people were telling me I was supposed to have like hundreds of pages. And I'm like, I had 4, but okay. And it wasn't even in specific to my technique either. It was just a general vaginoplasty guide of kind of here's what you need to know and here's what to do the night before. And
Yeah.
here's some things you need to take care of it after. Like very simple. It was just made out to be so light. On top of that, I feel like I was really convinced and I was really believing that this was going to be seamless because I was told I was so young. I I didn't have any severe health issues, that my body was going to heal well, it was going to heal quickly. This isn't like I'm getting my appendix taken out. This is like a complete reconstruction of your entire pelvic floor and the entire area, because I mean they're taking things out internally, externally, putting things in. We have a misconception that I think teenagers and kids going through hormones, it's just that they're just switching which biological puberty they go through, but in reality you just don't. You go through something that is induced by medication and is replaced by medication. You don't go through natural fluctuations of your hormones that correspond to like your body parts and what's going on mentally. You're on a steady stream of just different hormones and drugs. There's no fluctuation, and that's something I see now. Sorry, this is kind of off the point, but I see trans women do that where they talk about like going through like a period. They feel this like for a week because their hormones are like this and that, and I'm like, the whole point of the hormones when they prescribe it to you is you are on the same amount.
Yeah.
They don't fluctuate at all, or they're not supposed to. But back to the surgery, it was 7-hour procedure. From the time that I had the first consult with Dr. Roth, we submitted the insurance and immediately booked the surgery 2 weeks later when the insurance approval came back. Every complication that could have happened after I woke up completely happened. I woke up in so much pain, and I actually didn't fully know the extent of the pain because I was on an epidural, which is like what they give to women when they give birth if they don't want to experience the pain of
Oh,
contraction
okay.
and delivery. I was on one because of all the pain in my pelvic area. And
Yeah.
so I couldn't feel anything really from like the waist down, not even my legs or my feet. I couldn't move them. I couldn't go to the bathroom at all, which is, they said it was something I was supposed to do within like a day or two. I was on a catheter attached to like a Foley bag for a month, which is
Wow.
really bad for you. But I had no choice because Part of the procedure is they cut your urethra short because obviously with the penis it's much longer since it's
Right.
extending from the body. But in order to create a vagina, they have to put it right at the body. So they cut off a significant portion of it and they reattach it there. And for me, mine, I don't know why, but it was so swollen that it was almost swollen shut for about a month. So I had to have a catheter in with a bag on my leg for an entire month. It's such a that was one of the worst parts actually, just because it was all day every day for an entire month walking around. You can feel it inside. I can't go anywhere. I couldn't really do anything. It was nonstop like numb irritation and pain, and trying to sleep with it was so hard. Trying to move was so hard because if you would just move the wrong way, it would pull, or it would just cause a lot of discomfort. And so that was going on for a month ever since I woke up. Other issues I had were I had so much stomach pain from the graft being taken from there, just a lot of irritation. I couldn't walk either. I couldn't walk for about like 2 weeks just because of so much pain. I was on the epidural, so much pain in my pelvic floor. I would stand up for maybe like a minute and I would pass out. Like I would just get so lightheaded, I would pass out. I that time I was in the hospital, I was maybe bathed like once because I just couldn't get up to be cleaned, and I was bleeding like all over the bed all the time. There was so much blood. It was so swollen. A few days after the surgery, I they found that I had clots like in my legs, and some pretty large ones. So then I was on blood thinners for 3 months, and I had to give myself injections in the stomach twice a day. They did it through IV when I was in the hospital, but then when I
Right.
went home after the few weeks, I had to give myself the injections. Then I know that estrogen can increase the risk of blood clotting, and then also just being immobile for after a procedure for so long, I think I was just at a really high risk of developing them, and I did. From the moment I woke up, everything that could go wrong did. They told me I was originally only going to be in the hospital for like 3 days. I was there for a full 2 to 3 weeks. It was just nonstop pain, nonstop bleeding, nonstop swelling. And I mean, I knew that was going to be part of it, but it was at like the extreme end. Every complication was at the highest it could have possibly been. It just felt like my whole body it felt like my whole body was everything was reconstructed. Everything hurt so badly. Then going home, once some of those complications kind of leveled out, I still was having so many issues, especially with dilation. Dilation was the biggest one. Dr. Roth gave me 4 dilators, and you start off on the first one. Well, the first day that he gave them to me. So when you have the surgery, they kind of put like a stent inside, is what it's called. And so that basically keeps the vagina open, and then when they take it out is when you have to start dilating because it'll immediately try and close. He came in with 4 dilators and he used them on me and to see which one would fit currently. And he said, okay, so the second one, you can fit the second one in. So I want you to keep using that twice a day for 30 minutes. You need to keep trying to move up. So once you've been doing the second one for a while, try having that in and then try the third for a little bit. And then slowly try and get it to the third. And then you do that. And then you try and get it to the fourth. And the fourth is the goal. You need to be at the fourth one. You do that for, I know every surgeon's different, but for him, he said twice a day for 30 minutes for the first year. And then after that point, I think it's like once a week for about 30 minutes or an hour, something like that. Or you can replace it with having sex, is what they told me. He said that it's either at the year mark, once you're down to like just having to dilate once a week, if you have sex with enough frequency, then that can substitute it, is what he told me. And so I know there was a big encouragement for me to try and have sex once I was at a certain healing point. they
It's
they really
weird.
wanted me to try having sex, and I was just like, there's no way. This doesn't even look like a vagina. This doesn't feel like it. That's definitely not happening. And especially with the dilation went horribly. It was okay for like the first few weeks I was home. It kind of just felt like from when I was in the hospital. The second one was going in fine. But over time, I was just going backwards. I tried to get the third one in and I got to it, but then maybe for a few days and I couldn't anymore. And the pain got worse. It just felt harder and harder every time. even though I was dilating at the frequency they told me to. And
Right.
they told me up to a certain point, like after maybe 2 or 3 months, they were like, try using it to orgasm, like when you dilate. They wanted me to see if I would have like pleasurable feelings from it. And there was nothing like that at all. Definitely not internally, externally, nothing like that. It was swollen, it was painful, it was still bleeding. Like I had blood and some form of discharge coming out
Mhm.
every day. There was no pleasure in that at all. It was so sensitive and just so swollen and so painful. And I was going on 3, 4 months, no progress with the dilator. It was getting harder. It was more painful. It was more intense. And every single week, it just felt like I was closing inside, and it felt like I was like almost reopening myself up, which is pretty much what you have to do. But mine felt like I was ripping myself open, like every time I was doing it. And that was at the point they told me that it was supposed to feel good. They told me that it was
Right.
going like to try and use it as like a sexual experience.
I think it's weird that they told you that because you have said before it felt like you put a knife up inside of you.
It felt like a knife internally. It felt like a razor was like reopening my pelvic floor every time I would put it in. Especially by the end of that year when things just were fully closing up, it felt like I was tearing myself open again every time I did it.
Well, there's a difference between stretching and then ripping. And I kind of get where they're coming from. A vagina will open up more when aroused. But you have an operated vagina and not a real one, and you can't just relax or get aroused when you feel like you're ripping yourself apart when dilating that they wanted you to do.
It's definitely not congruent of an organ either. It's a completely different thing that doesn't function in the same way. Your body isn't connected to it in the same way because it's just not a part of your natural anatomy. It's completely man-made. That's one thing, like even after you have this surgery, it's never like, oh, you get aroused and you kind of things lengthen and expand, and that's a part of sexual arousal. Not even with a neo vagina. I read a lot of stories of people that had healed, and like if they had had surgery, then even though they had different techniques, they had talked about if they wanted to have sex, they had to use their dilator and stretch it, like stretch themselves
Like
open.
before?
Yeah. And
Oh,
that I saw that that was a big complaint. Like I had tried to look into more other people that had it done and see if anyone was going through what I went through. And I saw that a lot, which was something I guess I really didn't know, was that that was something that a lot of people that had to do in order to have sex is they had to use their dilator first and like leave it in to like prep themselves. For me, around like the 3 to 4 month mark was when I just felt like I was not healing in the right way. Dr. Roth had told me that obviously I was doing fine and this is normal, and I knew pain was gonna be a part of it. But around like 3, 4 months, I was like, this just doesn't seem right. I had a follow up with him. He told me I had lost like a few inches of depth. He said that it would still be fine for me to have sex with. I could use it. He really wanted me to try using it in a more pleasurable way, try using more lube. And he was just telling me that it was normal and that I could still try and preserve what I had. And so I went home. I was still trying to do all the things he suggested. It was still getting worse. I called so many times, like after the weeks after that and the months after that, that the pain was worse. I went down from the second dilator all the way to the first because it was felt like it was so swollen and it was closing up. But I didn't know what to do because I was doing exactly what I was told, and it just felt like my body was still fighting it. And he told me that maybe it was an infection of my prostate. And so he gave me antibiotics to see if that would help. It didn't. I didn't have any infection that was causing that. Really, just what was happening was it was closing. Up and from that, like that 3 month point, he didn't see me all the way till the end of the year when I called because I was in tears. I was mad over the phone because I was like, this is completely wrong. I'm at a point where I'm almost like in a few months I'll be at a year, like just 2 or 3 months, I'll be at a year, and I'm almost worse than when I started. And I don't know what's about to happen to me. I was terrified and I was scared because I was like, I'm supposed to be at a point where I'm healed. I'm almost there. And now I have no idea what's happening. I was scared. I was in so much pain. I was still bleeding. As soon as I would put the dilator in, bleeding, like a ripping feeling. And I would cry every time. I have memories where I was put in the dilator and I would actually call my mom while I was doing it because I was in so much pain. And I just had to tell her, I was like, I don't know what to do. Like, I don't understand why this is happening to me. And I'm already this many months supposed to be healed. And they've talked to me about this is supposed to feel good at this point, and it's supposed to feel pleasurable to do this. My mom was like, call, just keep calling, leave voicemails. Like, you need to go in there and we have to figure this out. My mom didn't want me to stop. She was like, there's no reason, like, there's no way that that can be good for you to keep doing this to yourself. But I told her, I was like, if I stop, then I give up on everything that I fought so hard to do. I felt like I would give up on this entire transition and that it was all going to be for nothing. I was able to get a hold of Dr. Roth. He had me come in. That was when we did something called a vaginoscopy, which is like a colonoscopy. They take a camera and go inside. And he looked at it, and what it was the tissue was fusing together to heal inside. And all that bleeding was because of the dilator kind of going back in and trying to open up that tissue again. And I'm so grateful that someone within the last like 2 weeks sent me information about a trans woman that had the same procedure done. And she talked about like how the peritoneal tissue that they use is prone to webbing because it wants to heal up. And so if it's near each other, it'll want to web and fuse back together. And it has a high propensity to do that. And so that's pretty much what was happening to me internally when we looked at it. Was I had scar tissue inside. He said that there was debris inside of the vagina from the scar tissue that was forming. So there was like pieces of it inside. The tissue was trying to close up. I was ripping it open. So that's what was probably causing the debris, was from the dilator going in and moving it. And my entire pelvic floor was scarred. It was collapsing on itself. And there was so much trauma to the entire pelvic area. And he told me that there's no other solution here than to have a second surgery to completely redo it. It felt like everything was over at that point. I felt like I had put myself through so much pain. I felt like my entire life was on pause because of it.
It is without a doubt 100% his fault, and it's disgusting that he's trying to blame you. Try to blame your pain that he caused on you.
It's still like I still live with it. It's really hard. And the physical part too. He told me that yeah, there was no point in dilating. It was going to close. It was just going to cause myself more pain, more trauma in the area. He immediately wanted me to go for a second surgery. I was open to it at first because I just wanted to be healed. I wanted to feel like a regular person, and this did not feel like that at all. That was when I met with the other surgeons, and they said that there was really no possibility for that just because of all the trauma in the area. They said it will happen again. That was the only option I had left. I couldn't do a penile inversion because there was no more of that tissue. So my only option was the colon graft, and all the surgeons said, no, like we will not operate on you, because it would have to be two surgeons, one that takes the graft and then Dr. Roth that does the vaginoplasty part. All the colorectal surgeons said no. They said this will have the exact same complications, probably more, and probably like life threatening if you do this. And so they all refused. And Dr. Roth kept telling me that it was possible. He didn't know why they would say that. And it was from there. I pushed back after the second one and I was like, I just don't understand what you're telling me anymore. How is it that both of these surgeons are saying that like this is will be so destructive if they do it, and you're telling me that it won't be, and that I need to just go talk to somebody else? And so from there, he didn't call me anymore. We just didn't have any more contact because I wasn't going to do a second procedure. And I pretty much just had to live with it. And it's been really hard. It's been hard, especially the mental side of it. Once like pain kind of went away, because for a long time, it was always like I could feel it, like in between my legs. I could feel the swelling and I could feel this like weight there. But after about a year, it was finally gone. It was really the mental part. Every day looking at it was like a reminder, especially because the outside looked bad too. And it looked so much worse than I anticipated it was going to. I thought that it was going to look really aesthetically nice, and it did not. And especially after closing and once the swelling was gone, did not look like that. Another complication I had at the beginning was I had something called a labial hematoma. So one of the new labias that's like made in the surgery, one of mine swelled and collected blood, so it was extremely swollen for months. I remember that. It was so visible on the outside. It was so swollen, like one side. It didn't fully drain, maybe like 4 or 5 months.
You can risk it falling off, right? If
Yeah,
it does.
potentially that can happen. And thank God it didn't. I already had enough complications. At least that didn't happen. The external part was also really depressing because it was like a daily reminder every time I would look at myself of what happened and what I had now live with, and that it doesn't look like a genital at all. It made me question like my own humanity at some points. I would question if I really felt like a human being at times because I would look at myself and I was like, what is this? How do I explain this to other people?
Because you don't think it looks like female genitalia, but it doesn't look like male genitalia either.
I was so insecure. And now it was like one problem that I was trying to solve just created a million more with having this procedure. But these are ones that there's no option to fix. It's been a very painful experience to like even years later. It hasn't even been that long since that happened. It's still a really painful thing to witness and look at every day. It's really hard.
I'm so sorry to hear that. If you don't mind me asking, did the dysphoria you had regarding your genitals become any better, go away after the surgery?
I deal with it's almost like a new dysphoria I
Oh,
live with. It just got replaced because I did have a lot of dysphoria as a kid around my genitals because I just wanted to be female. I didn't want to be a trans woman. I didn't want to be, and I thought that, that was going to be possible. Like going through hormones and blockers, I thought I was going to go through female puberty. And so that would all be taken care of that way. And then I thought having bottom surgery, that would take care of the genitals. And then now living with the genital that's not really male or female, and doesn't work at all. It's almost a dysphoria about being a person. It's like even more broad. It's less about like being attributed to one gender anymore and more about this just doesn't even look like what other human beings look like. It's hard because there's really nothing I can do to fix that. So I just kind of have to take it day by day and work through it and try to think about other things or but yeah, there's no solution and I don't know how to except cope. That's really the only solution that seems to be there.
sometimes not doing something is doing something. So I'm super glad that you said enough is enough.
I can't imagine the state I would be in if I had done a second surgery. It would be devastating.
Something that I want you to talk a little bit about is how you thought that if you transitioned as a kid, you could avoid being trans.
I definitely also know that this was a thought that I was having mentally that this would be possible. I also hold myself accountable, but at the same time, I was a kid. And so I kind of witnessed certain things that led me to that belief, especially because when I was starting to transition and looking into it like early 2010s, like 2013, 2014, there wasn't a lot of like stories of like transgender children yet that were really popular besides Jazz Jennings. Looking at Jazz Jennings and looking at the stories of other older trans people, it seemed like going through it so young, you had the opportunity to go through puberty as the opposite sex. And so to me in my brain, that seemed like it's not really like a transition anymore. Like this is me developing in a completely different way
Right.
biologically. And
Yeah.
so I really hung on and held on to that idea that that was going to be possible. And I thought that that combination with the bottom surgery was actually like going to be a full biological transformation. I thought once I had hit all those points that I wouldn't even really be like a trans woman anymore. I was just going to be a woman.
And it wasn't only you thinking this way, which is actually completely understandable. The doctors responsible for your transition made it seem like you could be a biological female.
Yeah, they said that I was going to go through a female puberty. I was going to go through female biological changes. Like the language of it as a kid made it feel real and that that's what was happening and that I didn't really feel like a trans person after a certain amount of time because I did go through a lot of changes being on hormones and on blockers. And my parents believed that as well. Like we thought that I doing this so young and doing all of this medical stuff that the gender clinic offered that I wasn't going to, like, at the end of it, just be a trans woman. I was going to be a woman, and that this is the way to do it. And that we're starting now because I'm young. They told me that it was going to go so well because I was young. Then you get to a point and you realize that that's not even what's happening. That was only this year that I really came to like reflect, and that's what I've done a lot this year, is reflect on that. It's been a really painful experience. It's been hard mentally for my family and myself. I think this was the year that we really looked at everything and we looked at what happened. It's not that we sit around and kind of say pick and choose what we should have done instead. It's more so just looking at the ideas that we were being sold, and the fact
Yeah.
that like Dr. Roth, the other doctors at the clinic, were describing it that way and we're saying it that way, telling my parents that I was so young, that this is going to be identical to a biological vagina. I was going through a biological female puberty. I was told that since I started the blockers and the hormones right at the beginning.
They have constantly been lying to you and to your parents about the medical transition. And as a trans person, you already have to go through so much: the gender dysphoria. In your case, you had a traumatic experience with your bottom surgery, and the doctors blamed you for the pain. And then on top of that, you had to comprehend how they've been lying to you since the beginning about what it means to be trans and about the transition. And now you have to figure out what is reality and what is not.
Reflecting on it and looking back now, and one of my biggest wishes that I think, not only for myself, but I think for other people that are looking into it, I think what we deserve is just honesty. People to tell us that your biological sex won't change, and that's okay. Like, that's fine. One of my biggest regrets was that as a kid, I wasn't going through a lot of psychological therapy. I wish that that would have been as just as big of a part of it as just taking medications and talking about surgeries and different procedures. I think I needed a lot of psychological help as a kid. That's my biggest wish, kind of when I talk about it now, and why I think it's just really important is that I'm not here to tell people what to do. I've never felt like I'm really at a position where I feel even comfortable doing that. I just advise people to take their time and slow it down, because as soon as I started, I couldn't go back. And I think if I had really sat and talked about things, I could have approached it differently. I don't know that for sure, but I think that that's important. I think that that's a really big part of it. I think like people that experience gender dysphoria, it goes on in the mind. And I think to completely ignore that and just say that you need to go this hormonal route and this medication route and this surgery route, but this occurs in the mind more than anything. That was never addressed for me at all. And now I'm an adult and I still need it, because now I'm just dealing with a brand new dysphoria that I really don't know a lot of people that go through. If I had done that as a kid, I could have really sat and talked about, why do I hate the idea of being a man so much, or being a boy? Like, what is that? Why? When did I, like, where is it that that could have came from? And now I'm an adult trying to kind of just understand that more. Not saying that like I want to go back, but more so just trying to understand myself better, because I never took the time to do that. No one did that with me as a kid. And so I feel like now as an adult, I still need to do it, because it just, that's something you can't ignore. I've learned from this experience that this all originates in somebody's mind, and you can't overlook that, like it was in my case. And that we believed the solution to whatever was going on mentally for me was the medications and the surgeries.
I love how you talk about honesty, because trans people who are not activists or woke will eventually figure out the truth about their identity. No matter if they like it or not, they have to, at some point, accept the truth. They will never be the opposite sex. It's not possible to change your sex. Coming to that conclusion is not easy. It's a process. Why can the doctors tell us from the beginning, you will never be able to change your sex, and most importantly, that is okay? Because I don't think we would struggle as much as trans people if we weren't being lied to all the time.
I wish I would have just been told that, and that would have really been reinforced to me as a kid, because I'm now trying to teach myself that years later after I've already gone through so much transition, because I was not okay with my biological sex and I didn't believe that I had to be that. I'm now teaching myself, after already so much transition, that it is okay that I am a biological man, but I want to look a certain way. I want to feel a certain way. That's fine. And I just wish that we would be open about it and address it that way, because I think it would stop a lot of people from subjecting themselves to so much medicine and surgery that is maybe not always needed, especially for young people. I now look back and I'm questioning, did I really need to do all of that? Did I need to do it this way? Did I need to do it that way? What if I had just taken my time? But when it's done, it's done. It's not reversible. And so we're in such a point where transition feels so fast and it feels so rapid, especially for kids. It's interesting. I don't feel like it really is. Like if someone's transitioning as an adult, it's not the same pressure as when they're a kid.
Oh my god, I talk about this all the time on my channel. The same people who say that women can have beards and deep voices, talking about biological men, are the same people who say that trans girls need to transition as a kid so they don't end up looking like a bearded lady. But what's wrong with the bearded lady?
It contradicts a lot of the procedures that people want to have done, like bottom surgery. Bottom surgery is extremely rough on anybody that's been on blockers or hormones as a teenager. It is so destructive, even more than it already is. I mean, it's a completely reconstructive surgery, but I was told the opposite. I was told that when you're young, it goes way better. And that, oh, you've been on hormones so long, it's going to be so good. You're going to look so good. When in reality, I have no development of my sexual organs, tissue, any of the functions that go on down there, and with that part of my body. And it definitely showed when I had the procedure. It was so rough. It was horrific. It was brutal. That's what happened to Jazz Jennings. That's what's happened to anybody that was super young and has been on blockers and hormones, and they try and do that surgery. And it completely contradicts what I was told for years. Doing this young, you'll have the world handed to you because it's all going to go so smooth.
Yeah, these doctors focus more on aesthetics rather than safety and health. And they also lie about gender dysphoria, which is a medical condition. They think, let's say, a trans girl is a girl trapped in a boy's body, so the transition is just an innocent fix. She is a girl and her body is the mistake, when in reality it's a boy with gender dysphoria, a boy with strong feelings that are not supposed to be there. That's the mistake. The gender dysphoria is the mistake. You know, it's in the mind, but that doesn't mean that the boy is a girl.
I love the way you put that because it's truly such a brand new phenomenon that's going on within our medicine right now. And it's funny because it seems so uncharted territory in that, exactly like you said, I love the way you put it, that this is happening in the mind. Like this is something that goes on mentally for everybody that has gender dysphoria. Like where else would it start? It starts in your mind and that's where it lives. And now our biggest advocacy for the treatment is right to the body, and that the body is the one mistaken, and that the body is the one that's incorrect. And now we need to completely alter the body and the way the body works. I'm frustrated because it's definitely not true that it's not effective for some people. However, it's being promoted so heavily and so intensely and so quickly and so young. And going through this as a kid, I don't know any instance where a child needs to be given like a puberty blocker, even the hormones. I think that having done this so young, I just don't see a child's place belonging in transition. I think you lose so much that's too important to give up. And I now feel that like in my 20s. I look back and I realized I sacrificed too much to do this that I can't get back. And now I'm like almost playing catch up. Like, oh, all of those things that I was feeling there are still here. This is something that happens with a lot of trans people, even like, even if they transition as adults, if they transition as children, you're sold the idea that this is your cure. Whatever it is that you feel mentally, that you feel upset about, that feels wrong, that feels this and that, transition is the cure to all of it. You will be happy, you will be successful, you will be loved. Like it seems like the big band-aid to fix every issue you're having mentally and in your life if you have any kind of gender dysphoria. And now that I've done all this medical transition, it's gone all different kinds of ways. It's gone really bad and it's gone so intensely. I still have things I need to address that are still there. That transition was not a fix for. You kind of wake up and you're like, my life goal was transition. What do I do now? And that happens to a lot of people. That happens to a lot of people, whether they start as kids or not. When we've medicalized this entire experience so much and we're saying hormones are the cure, surgery is the cure, gender care is the cure, to stop mental health problems and to stop risk of death and all these things. Now you're selling people the idea that that is their life mission, is to get the transition, and then suddenly the world opens up to them afterwards. And I'm not saying that it doesn't, but it doesn't cure anything that was going on mentally. It really doesn't. Like in the way that we're sold, I think sometimes.
We are human beings first. We're not trans. Trans doctors don't understand that there's more to us. And I always say that being trans is what I am, but it's not who I am. So I completely understand you. What are you gonna do now? But I want to clarify, you're not a detransitioner. You're still Briana.
I still like to present in a feminine way. I definitely take the time now to reflect on the experience of being a child through so much medicine and transition. And I really just want to provide that perspective to people because, as sad as it sounds, like I like to use my example to show people that I clearly had mental concerns as a kid. I look now and I realize there was a lot of mental issues I was having that are still here today. I think that we're not doing anybody that's, whether they're trans or not, I don't think that we're doing kids, I think that we're doing them a disservice by selling them the idea that the medicine is the cure. And in reality, we need to be talking to them while they do it. And it needs to be before, like long before, it needs to be during, and it needs to be the entire way after. Especially if we're thinking about a child doing this, which I don't even know if we should. And I don't really see a case where it's really necessary. I think that's one of the things I advocate for the most is that I think that we are really neglecting actual sit down therapy when people transition. I think we're doing trans people a disservice because for some reason we don't emphasize the importance of therapy when you transition. And I think that that's wrong. And I don't think that that's helping anybody. I started to like write a lot now, and that's something that I'm unpacking a little bit more. And one of the things that I share, and it's kind of embarrassing, but I mean, I look at it now and I think that it's a valid thing to discuss as possibly one of the origins of why I felt so much discomfort around being a boy was because I was always rejected by boys as a kid. My dad wasn't around, and it felt like my dad didn't connect with me on a father-son way. Ever since he divorced my mom, he was pretty distant, and then over time it was just completely distant after that. I had a stepfather after that who did not like me at all. He was really hurtful to me and my mom and my sister, and especially for me, he did not like my more feminine traits at all. I recall moments where he was really hard on my mom because my mom would kind of allow me to act that way sometimes. And she would have me go along with her if she was like going to get makeup or clothes and stuff like that. And he was really critical of that. I had rejection there. And then at school, it was even worse. I I was never friends with a boy. I never was liked by boys. I was always teased by boys. I was picked on them by boys. I was harassed by them. And I had moments where I was sexually harassed by boys. And I think I've talked about it when I like talked to Candace and like in some of my own reflections, I talked about the feeling that I felt disgusted with being a boy. I felt disgusted with the idea, especially of being a gay male. I felt so disgusted by it. It felt so awful to me. I couldn't see myself living that way. I didn't want to. But when it came to being with women and being with girls, I felt so safe and I felt so appreciated. I felt so
Affirmed.
similar. Yeah, I felt affirmed. And I felt so much closer to them and what that experience was like because I was always present with them. So now as an adult, sometimes I think about, and I think it's worth discussing because I think that, like I said, I think talk therapy is so important for a lot of us. And it's sad that it's not, that we're not making it a priority. But now I look at, is it possible that one of the biggest motivators for me to do this was the fact that I was so rejected by all the men and boys in my life that I thought maybe it wouldn't happen if I was a female. And this isn't just me, this is a lot of trans women. There's a big thing about like getting men to approve you, to be in approval of you
Right.
and your womanhood, right? I've talked about that before, and that was a big thing for me, especially within the first few years of my transition, being on hormones and blockers, because I thought I was going through female puberty. And so when I was like 3 years in, maybe like 17, almost 18, I was caught up in the idea of like, why do they not see me like other females? And I mean, it's pretty obvious why, but it was hard for me to mentally accept. And that was around the time that then surgery, I was like, maybe it's the surgeries. I haven't had it. And so that's what I need now.
Yeah.
And so I look around and I'm like, what if I had sat with somebody and I talked about that as a kid? I felt like I was fighting so hard for the men in my life to approve of me. And when they
Yeah.
didn't, and I felt like I was giving up, and I hated myself for being a boy and being a man and being so rejected by them and disliked by them, that I thought, Is it possible that in my brain I could have been completely disgusted by my own identity as one, and that being a female would fix it? And that maybe not as a boy, but as a girl, I can be approved of and I can be accepted by them.
What most people forget is the ones who seek help to transition in trans clinics are not always sure about the decision. Some are still questioning or have questions about gender dysphoria, so it's a trans doctor's job to figure out what's really going on with their patients. They have to be neutral and not automatically affirm them as trans. It's not the patient's responsibility to self diagnose or self medicate, and they shouldn't, as patients, have all the answers when coming to the clinic for the first time.
Yeah, and it takes so many years to fully understand that. Like that's something I've just thought about within the last month. That was definitely a prominent thing going on for me for the last decade of my life. Was over time I felt so rejected by my own sex, my own biological sex. And it was around that time as a teenager, is it possible that being a female would fix that? 13, 14, like you don't even have a solid self-concept of who you are as a person, what you value, what you believe in, where you stand in life, what's important to you, what are your goals. You don't know those things, and you don't even fully have to because you're a child. And so you're still developing. But to say that there is one feeling about a gender and the solution is immediately to make a complete change to the body that can never be undone, I think it's just so harmful. I just don't think it's the right approach. I don't think that, and I'm sure that there are times it works out, but there's a lot of times it doesn't. And I don't think that that's a risk we should be taking, because it could
Right.
just lead people to a path where you're neglecting what their real needs are in that moment. I think the medical industry has just accepted that, one, this makes us the most money, and two, we have a one-stop solution for anybody that has any, because especially the way everybody feels about their gender is different, even among transgender people, transsexual people, people with gender dysphoria. We all think of it in our own way and differently. We all came to the idea of it differently. We're all
Right.
dysphoric about different assets of it. There are some trans people that have no dysphoria with certain parts of their body that still resemble another sex or their biological
Um,
sex, and they're okay with
well,
that.
me,
There's
in
some
a way,
people,
yeah.
right? Yeah, and there's some people that don't like anything. And so that in and of itself shows that we all don't approach it even the same way. When you go in there, there is a one solution for everybody. And we're saying that we're so hellbound on saying it's the right way, especially for kids.
Yeah, especially kids. Adults apparently do not need to transition in order to be trans, but if we don't allow children to transition, we're against their basic human rights and their existence.
No, they can exist. Like nobody's saying that they can't exist. Every life deserves to be here. That's not, I don't understand that argument. I truly can't wrap my head around. And this is as somebody that lived it, and a lot of these people have not. I just don't understand how they have become so quick to accept the idea that doing this will save their life and that these people will not live if they don't. When I'm telling you that more than likely, if they are making these choices, because they are, if they're a child, they're making them and they're not ready. You are setting them up to have a lot of complications in the future. And I'm really dealing with it now in my 20s for being on this for so long and living on these medications and having so many surgeries. Having a lot of plastic surgery in general can affect you in a lot of ways
Yeah.
mentally, and the blockers too. And I had thought about this just yesterday. I just think that there's no place where we need to be giving blockers and hormones to kids, just because you don't fully feel the mental effects of being sterile until you're in your 20s. You start to really be in those prime reproductive years. And now that I've just sort of entered that, I really feel it, the mental side of being on the blockers and hormones for so long. And I haven't seen it talked about a lot, because as a kid, I didn't fully understand what that meant to become sterile, to not have children. And when it's told to me in a way that, you can still freeze your sperm and you can have biological children, but it's expensive, you have to pay for it every year, and you have to pay every year that you don't use it. It just didn't seem practical to me and my family as a kid. And I was 14. I just wanted to be fixed. I just wanted to look the way I wanted look. I wanted to be seen the way I wanted to be seen. And I didn't care about having kids. I never thought I wanted to have kids. I was 14, so that kind of makes sense. I don't know a lot of 14-year-olds that are hellbound having children, or that's a priority.
You couldn't consent to the transition or to you being sterile. You didn't sterilize yourself. The doctors did this. And expecting you to make a decision if you want to have kids or not when you were a kid yourself is just unethical.
You don't understand the lifelong effects of it either. There's just not a lot of trans youth and trans people like that transition as a kid that are now entering older years and talking about how it feels. And so I'm really grateful to kind of share this because one thing that I've definitely felt within the last year, the heaviest it has ever felt is now. I didn't think of it at all because as a teenager and being on hormones and stuff, even other teenagers are not thinking about having kids. That's not in your mind space at that time. And now though, I'm at an age bracket where my peers, my friends, the people in my age group are beginning to have those experiences or already having them in terms of reproduction. People are
Yeah.
starting families. I see people in long-term relationships, people discussing kids, the people around me having kids, and you're witnessing the fulfillment. You see that it's such a key point of being a human being in your life is the ability to reproduce and the ability to connect with people. I'm not saying that every human connection or relationship is about reproduction, but it does. It's I mean it's in our biological nature. It's a big part of it, and I see that. I see it in other people. I made that choice so young, and you can't go back. And so I witness everybody go through it, and I see the fulfillment. I see the pride that they have in their families and their children and their relationships. I see people even just having sexual relations, people connecting with other people in that way. And I listen to all the people around me talk about it. I see the pictures of their families talking about having kids. And I just sit there and I'm like, sometimes I can't believe that I said goodbye to all of it over 10 years ago.
I always say that it doesn't matter if a gender dysphoric child will end up living a transsexual life as an adult, no child would benefit from a medical gender transition.
It's not worth it. You don't develop fully in a biological way. In terms of like what natural puberty is like. It does not happen once you do blockers and then especially hormones. They're not comparable how you develop. It's not the same thing. I just don't think that should be sacrificed. I think it's so important, especially mentally. I think that's something I'm looking at now and I'm really sitting at myself and I'm looking at. Why is it that I still have so many thoughts that I was having mentally as a 14-year-old, as a 13-year-old? Like I'm still having those thoughts and those feelings still there. I don't think that transitioning is a child's place. I don't think that it's acceptable for them. I don't think that it's safe for them more than anything. Like I don't mean it in a way to be mean or to say that, well, I did it and I don't like it, so no one else can. I
It
mean it in a
sounds
way
so.
that yeah, I mean it in a way that I lived it. I know the sacrifices and the things I lost doing it, and it's not worth it. It's not. Like children deserve to be healthy more than anything and complete that part of their development. It's so important. And giving it up just for an aesthetic reason, it's not worth it. Because that's the main reason we're doing it. Like there's no other reason, really.
Right.
Like
Right.
there's no health benefit that can be documented from putting somebody on a puberty blocker and a hormone, besides the fact that doctors and everybody believes that these kids will look better if they start it now versus later.
What do you have to say to the people who still believe that the benefits of giving a child puberty blockers trumps the long list of serious side effects? The ones who prioritize passing more than anything else?
I think my response to that is having lived it and seeing it from that firsthand perspective, sacrificing your mental and physical well being, like your actual wellness, the way your body and your mind feels, it's not worth an appearance because you will still have those problems when you start blockers and hormones. When that kid turns 20, when they turn 25, when they turn 30, they're still going to have the same mental concerns before. If you are solely addressing their physical appearance, you are not taking the time to fully help them work through what's going on mentally, where this is coming from, what thoughts led them to have this. And there's a huge focus on the aesthetics of these children. And I felt like that was a big part for me. Like my transition was focused on solely appearance. You're sacrificing your health when you do it. You're sacrificing your well being. You're sacrificing the way you view the world and the way you view yourself. And you're subjecting yourself to medications that not even doctors fully understand. I try looking up all the time what are long-term stories, details about someone that is male to female about estrogen. Is there any information about their entire life of what kind of she's? No. I tried looking that up like 2 days ago. I couldn't find it. So we fully do not even know what this will look like in 30 years, 40 years, 50 years. And you are willing to have a child that is prepubescent, just starting puberty, accept that fate for the rest of their life just because you believe they'll look better to people in the world. And I think that we all need to like think about that question a little bit more. And it's another criticism I have. I think that a big criticism I have is that it's pretty interesting that what we're seeing now is this hell-bent idea that people are on, where if a boy is too feminine or a girl's too masculine, that means they're trans, they need to start transitioning. And I think that we all need to really, and this is on every side of it, this is every side of it. We need to work on the idea that boys and girls can act very differently amongst each other. It doesn't mean that like their bodies are wrong. It doesn't mean that there's something wrong in their brain. I think that that's just how, because we're human beings, we're all pretty different. And so I think that I think that to me, this demonstrates we have a lot of work to do on that. We are still very caught up in the idea that men and women need to look and behave certain ways. And I understand where that comes from. That comes from biology, that comes from traditions, that comes from cultures. Look at where we're at now. It's gotten to a point that we all need to really reflect on why is it that we are hell-bent on this on both sides of it. And it's funny that even people that are so prominent in advocating for trans care, they are pushing that idea a little bit. They're saying that if these girls act any kind of way outside of this, then they're just boys. And boys that act any kind of way like this are just girls. But then, even on the other side of it, we also need to stop criticizing when boys and girls go outside of these boundaries.
Yes, of
Because I
course.
did, and I was tortured for it as a child. If I had really been in a space where adults made me feel safe about that, if people around me really took the time to say that it is okay for you to behave like that, for you to have those
Yeah,
interests and those passions, things could have been different. I don't know for
right.
sure. It's something important that we need to think about and we should talk about.
I hope you know how powerful it is that you're speaking up, talking about your story. Your story is, of course, tragic. However, your story is the perfect example of why it's not okay in any way to do this to children. And now maybe a lot of people will wake up when listening to your story. So I just want to say thank you so much for coming out because you actually lived as stealth at one point, right? Meaning that you don't tell people, new people especially, that you're trans and they just assume that you're a woman.
I would say about 4, 5 years I did. Because I always say that I began to like really pass in a way that was noticeable when I was like 17. At that point, I would go outside, and even though people at school knew I was trans, at that point though, people always just said she and they said my name. And so it just wasn't as prevalent anywhere except where people knew my history. You don't feel authentic either. I felt like I was hiding so much of myself. I felt like even more of a struggle and a hassle to live that way. When in
Yeah, I can.
reality, I could just be honest about it, and then it is what it is, and I don't have to worry about people's reactions or confusion or people being upset when it's always been there. And I think that I wish I would have always chosen to do that, but now I do. So
So now that you've been on Candace Owens' show, you've been on Buck Angel's channel and now my channel, what do you want to do next?
it's hard, and I think, and honestly, I'm so grateful because people have really connected with it in a lot of ways. I can't even begin to describe the amount of people that have reached out and have shared that this was the story that really opened up their mind to more of the conversation. It's such a powerful thing to hear. And I knew that I had the opportunity, I think, going on Candace Owens, that it was going to be very unique. It would, especially because she rarely does a lot of sit down interviews like that, let alone with a trans person. I knew that I had the opportunity to really make the best of it. Going into it, I said, I don't want to butcher this. I don't want to come across like unstable. I don't want to come across like I'm there to fight for her to think of me as any kind of thing. That's not the point. I did not plan on being that emotional. I really did not want to, because I thought people were going to think I was really weak if they saw that.
No,
I wanted to just come across very focused. I wanted to come across like so,
you were.
not like cold, but like that I was really strong, like in every way. But I think that that worked out though for the best. I think people got to see how painful of an experience it is. This kind of intense medical transition that we're all talking about is really not a space for a child to be in. And I think that for a lot of people, it was really powerful to hear a child that was in it say that. Because right now, when we see people talk about it, it's adults, not really any kids. So I think to hear a child say it that lived it was really impactful for a lot of people. I think it was really special to show that there's a very different side of trans people as well that's just not getting a lot of attention that I think should. And that there are a lot of us willing to sit and really critique some of the negative aspects of what's going on with transition, why it's really harmful, and also just being more open and honest about the things we agree and disagree with, and that we're willing to have those conversations. It really reminded me that a lot of people have seen us in a very intense way, especially in the news. You see a lot of interesting examples of us, and it's not doing us any favors at all. So I'm really honored that I feel like I got to show a different side of that. I think if when the opportunities come, I'll definitely like approach them and see what I can offer. I feel like I just have a different approach to a lot of it. People really want to see my face a lot. I think we talk about it a lot more, and I want to. I think I struggle because I don't want to feel like I'm dictating people's lives. That's something that's kind of hard for me. Is that I don't want people to feel like I'm sitting up here saying what we have to do, because I've never really claimed that either. I feel like my purpose is to just really provide a perspective and an idea that I feel like a lot of people haven't, because there's just not a lot of people that have been in like my shoes that really come out and talk about it.
When it comes to trans discourse, we talk often about trans kids. So I think it's great to hear from you. You've had this experience yourself. And I love how you're now a part of the debate. So don't get me wrong, what you've been through is traumatic, very traumatic, but the amount of information you can bring to this debate is absolutely amazing.
That's what my purpose is, and like when I talk to people, is that I'm able to actually answer it from like a firsthand perspective, because I think for so long the conversation was all just hypothetical, because we knew it was happening, but the kids weren't talking about it. And kids transitioning really young was beginning around the time I was doing it, and just a few years before that, Jazz. Like Jazz, I mean, was socially transitioning for a long time, but her and I are very like almost the same age, and so really starting the process in a very similar time. Like transgender children were starting around the time that I started, and so now that the beginning of us are really entering like our 20s, the ones of us that have done the full medical transition that I think is so praised among like the trans community and is so advocated for, and that they want to protect. I think to actually have someone that's lived it to actually talk about it, I think is really important. And I feel like that's what really drew me to do it, was that I didn't see anybody else really willing to do it. Either that or they weren't willing to share, I think, some details, which I understand. I completely understand it's not easy. I realized that I had a special opportunity to really show people exactly like what happens and what you go through.
Where can people find you and hear more about you?
My YouTube is just my name, Briana Ivy. I've done one that's more specific about the surgery. I've done one that really talks about like the childhood, the blockers and the hormones. And then I just did one answering like some questions that people have sent me, because people have a lot of questions, especially after the Candace interview. I'm still planning some more. I want to branch out and talk about other things that I see, trans or not, talk about some parenting, like some tips for parents that are having children that are questioning their gender identity. I also really want to talk to detransitioners as well. I have a lot of empathy for their stories and what they've been through, because a lot of them have been through really intense medical experiences. And that's something I would love to connect with them on. And I have with a few and other young people that have experience in this world. I think that's going to be what we see a lot of coming soon.
Thank you so much. I'm super effing grateful for you and your
I'm so
voice.
grateful for you. Thank you.
I hope to see you more on
Mhm.
YouTube, and I'm
Yeah.
excited for more content coming from you.
Thank you so much. Yes, it's coming. I promise. Yes, a lot more.
Awesome.
Thank you for watching this video. If you want to check out Briana, I'll leave some links down below. Please follow her on social media. Leave the kids alone, and I hope to see you all in my next video. Peace out.